Okay, so I'm going to do an intraoral exam now. This is my patient, and I'm dressed in full PPE. I'll have you go ahead and put the camera on your mouth. Perfect. So what I'm going to start with is I'm going to start with inspecting the lips and the vermilion border, which is right here around the lips. Everything looks good. The philtrum here looks good as well, even though it's covered by a little bit of hair. Labial commissures look good. There's no cracking, there's no cuts, there's no redness or dryness. Next, we're going to go ahead and look at the vestibule and the frena and also the alveolar mucosa. So what I'm going to do is I'm going to slightly open my patient's mouth, and I'm going to examine the vestibule, which looks great. I'm going to examine the frena, which is here and here. Looks great. The alveolar mucosa looks great as well. I'm also going to retract and visually examine the buccal mucosa and the linea alba. It looks like he has a unilateral linea alba over here on this left side, but not on the right. What we're going to do next is we're going to go ahead and find the parotid papilla and the Stenson's duct. So I'm going to go ahead and place a cotton tip on the Stenson's duct and dry it, and then I'm going to milk it for saliva. Okay. Dry it. Perfect. Yep, and that produced saliva because after I dried it, it became wet again. I'm going to now press with the end of my mirror to check for the salivary flow, which in that case I just used a Q-tip and we were able to find it. I'm going to go ahead and look at the maxillary tuberosities, so I want you to tilt your chin up. Open big. Good. Maxillary tuberosities back here look good. I'm going to check for the retromolar pads back here, which also look great. I am then going to palpate, go ahead and close. I'm going to go ahead and palpate the lips. I'm going to palpate the mandibular and maxillary portions of the vestibule. So go ahead and open. I'm just going to feel down here. Good. And I'm going to feel up here. Good. I'm now going to palpate the tongue. And as I'm palpating all these objects, all these structures, I'm feeling for any swellings or lumps. Okay. I'm also going to bimanually palpate the floor of the mouth. So I want you to lift your tongue up and put it on the roof of your mouth. Good. And I'm going to put my thumb on the bottom of the chin as well so that I can feel the floor of the mouth. Good. Okay. I'm going to run my finger over the alveolar ridge of the maxillary and the mandibular arch. Okay, that feels good. And I'm going to have my patient open his mouth very, very big, and I'm going to examine. Go ahead and open big and tilt your head back. I'm going to examine the hard palate. Good. And I'm going to examine the oropharynx. Good. As you're tilted back, open. I'm going to examine the incisive papilla, which is right here. The palatine raphe, which are right here, which is right here. The palatine rugae, which are right here. And then the soft palate and the uvula. Go ahead and say ah. Ah. Good. Okay. Now I'm going to also check the palatine tonsils, which are in the back. I'm going to check the anterior tonsillar pillars, the posterior tonsillar pillars, which are also called fascial pillars. I'm going to make sure that as I'm doing all this, I'm monitoring the mobility of the tongue, which seems normal. I'm then going to have him stick his tongue out, and good. And I'm going to look for the filiform, fungiform, and circumvallate and foliate papillae. Good. I'm going to go ahead and stick your tongue out again. I'm going to grab his tongue in a little piece of gauze and slide it over so that I can look at the papillae over on this side and the papillae over on this side. Okay, looks good. I'm then going to examine the ventral surface of the tongue and the floor of the mouth. I'll have you go ahead and touch the roof of your mouth with your tongue. And I'm going to make notes of the frenum, which is here. Good. The Wharton's ducts, which are down here as well, so there is salivary flow. And there's also lingual veins and fimbriated folds down there as well. Okay, And you can go ahead and close your mouth. Perfect. And then what I'm going to do next is I'm just going to make sure and I document all of my findings and let the patient know everything is normal today. There's nothing to worry about. And now we'll go ahead and start with the actual cleaning process. Thank you.